Alberta, we have a challenge, and it's not just our COVID-19 numbers. We are increasingly challenged by polarizing narratives that on the one hand say we need to drive to zero cases at all costs, and on the other hand say that COVID is a mild illness for most, so we should let it spread freely and pursue herd immunity. We are not well served by false dichotomies or by any positions that make it harder to have the respectful dialogue that a complex, wicked problem like COVID-19 presents. We must continue listening to each other and striking a difficult but necessary balance. We cannot live in fear and terror of COVID-19 for months to come. Yet we also cannot abandon our efforts to protect the most vulnerable members of our communities and to make sure the health system can continue meeting all Albertans' health needs. I don't ask that you fear COVID-19, but that you respect it. COVID is a novel disease that is not just the flu. It has the ability to overwhelm our health system and weaken essential services if we let it do so. Respecting COVID-19 means taking public health advice seriously and taking care of not only ourselves, but also our communities by preventing transmission. I also ask that each of us do everything in our power to maintain respectful dialogue with those who have different opinions. We cannot let COVID divide us. We will find better solutions by continuing to work together and finding strength in diversity. Having said that, we are also facing a COVID-19 challenge. You have heard me say many times that we need to achieve a balance between minimizing the risk of COVID-19 and minimizing the risk of harms of restrictions. This requires us to keep the spread of COVID-19 manageable. We have now crossed a tipping point and are losing the balance we have been seeking. Last week, Edmonton Zone moved to defer elective surgeries in order to deal with all the system pressures that COVID is creating. These pressures include not just COVID-19 patients in hospital, but also outbreaks in continuing care that prevent patient transfers, staff shortages due to illness or quarantine, and a need to treat any patient with COVID-like symptoms or exposure with robust infection control precautions, meaning, among other impacts, that multi-bed rooms cannot be used to full capacity. The trigger of COVID hospitalization growth that we have been watching is not above 5%. However, we need to respond to the actual situation, not just the metric chosen in the spring. This weekend's COVID-19 numbers tell the story clearly. We identified on average 480 cases of COVID-19 per day over the weekend. Breaking it down by day, on Friday, 364 new cases were identified, while our lab conducted more than 16,000 tests. On Saturday, we completed over 17,000 tests. We also identified 572 new cases. And yesterday, we diagnosed 504 cases and completed almost 12,700 tests. There are currently 118 people in hospital in Alberta, including 16 in intensive care with COVID-19.